Small intestinal bacterial overgrowth SIBO is a medical condition. Because this picture shows that overgrowth of bacteria in small intestine. X-ray findings. Look at this in small intestine and MRI. Then CT findings. Look at this. A detail going on. Introduction. Small intestinal bacterial overgrowth is a medical condition characterized by an excessive growth of bacteria in the small intestine. Unlike the colon, which hosts a significant amount of bacteria, the small intestine typically has fewer bacteria. SIBO disturbs this balance, leading to various gastrointestinal and systemic symptoms. Etymology. The term small intestinal bacterial overgrowth combines the descriptive phrase small intestinal, referring to the small intestine, with bacterial overgrowth indicating an excessive proliferation of bacteria in this region. Its roots lie in the Greek word bacterian, bacteria, and the Old English word overgrown, overgrowth, reflecting its medical focus on abnormal bacterial populations. A definition. SIBO is defined as an abnormal increase in the number or alteration in the type of bacteria in the small intestine. This condition can interfere with normal digestion and nutrient absorption, leading to malnutrition and other complications. Types. 1. Methane dominant SIBO caused by an overproduction of methane gas by archaea in the small intestine. 2. Hydrogen dominant SIBO characterized by excessive hydrogen gas production due to fermentation by bacteria. 3. Hydrogen sulfide SIBO involves an overproduction of hydrogen sulfide gas, often less common but associated with unique symptoms like diarrhea. Causes. 1. Structural abnormalities. Example, strictoris diverticula. 2. Reduced gastric acid production. Example from prolonged use of protein pump inhibitors. 3. Impaired intestinal motility, example in condition like irritable bowel syndrome or diabetes, or immune system dysfunction. 5. Surgical interventions, example blind loop syndrome post gastrointestinal surgery. 6. Chronic pancreatitis or liver diseases. Risk factors: 1. Advanced age. 2. Irritable bowel syndromes. 3. Diabetes mellitus. 4. Long term use of antacids or protein pump inhibitors. 5. Neurological disorders affecting gut motility, example Parkinson's diseases. 6. Gastrointestinal surgeries. Complications: malabsorption of nutrition, example fat soluble vitamins B12. 2. Weight loss and malnutrition. 3. Chronic diarrhea. 4. Small intestinal inflammation. 5. Increased intestinal permeability. 6. Systemic symptoms including fatigue and joint pain. Pathophysiology: SIBO occurs due to disruption in the normal mechanisms that limit bacterial growth in the small intestine. These mechanisms include gastric acid secretion, intestinal motility, and the ileocacal valves function. When these are impaired, bacteria can proliferate in the small intestine, leading to formation of carbohydrates, gas production, and inflammation. The resulting dysbiosis affects nutrient absorption and disturbs gut integrity. Here's a step by step outline of its pathophysiology. Pathophysiology: 1. Disruption of normal gut defense mechanisms. Gastric acid deficiency, impaired motility, anatomical abnormalities, ileocecal valve dysfunction. 2. Alteration of the small intestinal microbiome, overgrowth of bacteria, shifts in bacterial composition. 3. Formation of undigested carbohydrates, increased gas production, altered gut pH value. 4. Disruption of digestive and absorptive process. enzyme inhibition, nutrient malabsorption, protein loss. 5. Immune and inflammatory response, mucosal damage, systemic effects. 6. Clinical manifestations, symptoms, abdominal pain, bloating, diarrhea, constipation, and nutrient deficiencies. Example, iron and fat soluble vitamins like A, D, E, and K. Long-term effects, chronic SIBO can lead to conditions like weight loss, osteoporosis from calcium, vitamin D malabsorption, and anemia. Understanding this step-by-step mechanism highlights the importance of addressing both the underlying causes and the bacterial overgrowth itself to manage SIBO effectively. Signs and symptoms. 1. Abdominal bloating and distension. 2. Chronic diarrhea or constipation. 3. Abdominal pain or cramping. 4. Excessive flatulence. 5. Unintentional weight loss. 6. Fatigue. 7. Nutritional deficiencies, example anemia from B12 deficiency. A diagnosis, breath tests, non-invasive test measuring hydrogen or methane levels after ingesting a sugar solution. Example, glucose to small intestine, aspirate and culture. Consider the gold standard but invasive and less commonly used. 3. Blood test to identify nutritional deficiencies such as low levels of vitamin B12 or fat soluble vitamins. 4. Imaging studies to identify structural abnormalities contributing to SIBO. X-ray, CT, MRI. Nursing diagnosis. 1. Altered nutrition less than body requirements related to malabsorption. 2. Chronic pain related to abdominal discomfort. 3. Impaired gastrointestinal motility related to dysbiosis. 4. Risk for fluid volume deficit related to diarrhea. 5. Knowledge deficit related to disease process and management. Management. First, medical management. 1. Antibiotic therapy, rifaximin and metronidazole and commonly used to reduce bacterial overgrowth. 2. Prokinetic agents to improve intestinal motility. 3. Dietary modifications low FODMAP diet to reduce fermentable carbohydrates. For nutritional supplementation, addresses deficiencies in vitamins and minerals. The nursing management: 1. Monitor nutritional status and weight. To educate the patient to dietary modification and treatment adherence. 3. Manage symptoms such as pain and diarrhea. 4. Encourage hydration and electrolyte balance. 5. Support compliance with prescribed medications. Treatment options: first option is antibiotics tailored to reduce specific bacterial growth. 2. Dietary changes: low FODMAP or elemental diet to limit bacterial substrates. 3. Probiotics to restore gut flora balance. 4. Surgical intervention for anatomical abnormalities causing SIBO. 5. Adjacent therapies such as bile acid binds or pancreatic enzyme supplements. Psychosocial medicine: 1. Provide emotional support and counseling to manage the psychological impact of chronic symptoms. 2. Encourage participation in support groups for individuals with SIBO or similar gastrointestinal conditions. 3. Educate on stress management techniques such as mindfulness and relaxation exercises. 4. Foster a positive coping strategies through regular follow-ups and reassurance. Prevention: 1. Maintain healthy eating habit to support gut motility. To avoid unnecessary use of antibiotics to preserve gut flora. 3. Manage underlying conditions like diabetes or IBS effectively. 4. Stay physically active to promote gastrointestinal motility. 5. Regular follow-ups for individuals at risk due to surgeries or chronic illness. In conclusion, SIBO is manageable but complex condition that requires a multidisciplinary approach for effective treatment and prevention. Early diagnosis and tailored interventions can significantly improve the quality of life for affected individuals, reducing complications and promoting long-term gut health. Thank you. Have a nice day.